Hi friends, Dr. Harsha from Vice Academy. Small video on initial part of Crohn's because it is a very important topic. So Crohn's actually is MCQ that can ask is most common primary surgical disease of small bowel. So what happens is usually seen in the second and third decade of life, and also it has got a bimodal presentation. It has got strong genetic disposition, and see, the thing is, there is up to 30-fold increase risk in the siblings and up to 14 to 15-fold increase in the first degree relatives. So, certain bacteria are implicated that we need to remember. One is atypical mycobacteria. That mycobacteria is Mycobacterium paratuberculosis and intestine adherent E. coli. Like you have to ganta bajna hai, like the UPEC, urothelium adherent pathogenic E. coli. Here also you have something called enteroadherent E. coli. Apart from that, other bacteria that have been implicated are the um, increase in gamma proteobacteria and acinobacter. So actinobacter. So these bacteria you need to remember, and certain genes are there. NMMA is the code. So amongst all these genes, now what is most important is NOD2, NOD2. So if you have to remember about one gene that is very important bearing in Crohn's disease is NOD2. So that you need to remember, and other factors, yeah, smoking is a risk factor. Some drugs like aspirin, OC pills, NSAIDs, all these things are the risk factors. Apart from that, obviously, we know the Western diet, taking less fiber and increased fat intake is also a risk factor. Very few important points which already you might know, it will be a revision. Crohn's disease, you have skip areas, it is a segmental disease, and very, very important thing that differentiates it from ulcerative colitis is that it is rectal sparing disease. And Crohn's disease can affect from mouth to anywhere up to the GIT, even the appendix, ileum, colon. So the most common site, according to Sabiston, is if you see ileum plus colon is around 55%. Only ileal disease is around 30%, and colonic disease is around 15%. So ileum is the most common site for Crohn's disease. Having said that, on long-standing Crohn's also you need to remember that uh, it can turn malignant, and the most common site of such malignancy, which is a aggressive adenocarcinoma with mucinous behavior, is also ileum. So apart from that, what happens in Crohn's is the skip areas, as I said, segmental disease. And once you put a lab coat and see inside, the fat is encasing around the bowel. It is called something typically called as creeping fat. So here you have to remember one thing, one sign. Already in one mock exam we have given ring sign in a sclerosing mesenteritis. Okay, so that is one condition where the fat is normal. Here the fat is abnormal. So other things are fistula formation is there, obstruction, can go into obstruction. Sometimes there might be perforation, toxic megacolon. And typical feature is once you cut open the intestine, you find aphthous kind of ulcers in the intestine. So that is about the pathophysiological aspects. And one more thing that you need to remember is the classification is Montreal classification. In the Montreal classification, they have taken three parameters. One is age of presentation, other one is site of the disease, and other one is behavior. Behavior means is it a penetrating type of disease or structuring type of disease. So based on that, they have classified. So the higher the score, obviously the prognosis is going to be poor. So what we will do is, this is about the initial part of Crohn's disease. The other part we will discuss in another video. Thank you.